Hi there, I'm here to explain today on pelvic diaphragm and perineal body. So here is the bird's eye view of pelvis, means from the superior view of pelvis, showing the lateral pelvic wall and the floor of the pelvis. So we can appreciate the muscles forming the lateral side and the floor of the pelvis. And here is the sacrum, which forms the posterior part of the pelvis. And on each side we can see the ilium, and anteriorly we can see the pubis, pubic symphysis, and connects to the ilium by superior pubic ramus. We can appreciate all this, and we can also appreciate the pelvic inlet here. So this image demonstrates the muscles of lateral pelvic wall and floor as well. So first we shall begin with the lateral pelvic wall. Here we can see the muscle called as obturator internus present on the each side, forming the lateral pelvic wall. And obturator internus, if you see its attachments, it attaches from the pelvic surface of the ilium and ischium. This is the pelvic surface of ilium and ischium, and it also gains its origin from obturator membrane, and finally it gets inserted to the greater trochanter of femur. And nerve to obturator internus is the nerve supply, which is having the root value of L5, S1, S2, and this muscle helps in rotation, lateral rotation of the thigh. Next, about the posterior superior part, you can see here a muscle called as piriformis. Piriformis means pyramidal shaped muscle, which forms the posterior superior wall of pelvic wall. And this piriformis, we can see it is attaching from the sacrum here and running laterally into the greater sciatic notch, where it comes out and gets inserted into the greater trochanter of femur. So piriformis, it gets origin from S2, S3, S4 sacral segments. So you can see the vertebra S2, S3, S4 giving origin to the piriformis. So that is the pelvic surface. It gets origin like letter E. And then after crossing greater sciatic notch and sacrotuberous ligaments, it gets inserted to the greater trochanter of femur, and it is supplied by anterior rami of spinal segments S1, S2. So directly anterior primary rami of S1, S2 supplies the piriformis. Piriformis also helps in the lateral rotation of the thigh along with obturator internus, and it helps in abduction of the thigh as well. And it assists in the holding the head of the femur to the acetabulum. So that is the action of piriformis. So that was about the lateral and the posterior superior wall of pelvis. Now we shall go into actual pelvic floor, which is mainly formed by coccygeus muscle. You can see here coccygeus muscle and the levator ani muscle. Coccygeus and levator ani, they are together called as pelvic diaphragm, the muscles forming the pelvic diaphragm. So coccygeus, the actual name is ischio-coccygeus because it gains its origin from the ischium part of the hip bone, and it attaches to the coccyx and partly into the sacrum. So that is about the coccyx. And next you can see the levator ani, which is having several components. Mainly we can say into pubococcygeus and iliococcygeus are the two components of levator ani. So iliococcygeus here, which is present on each side and where it is like triangle, gaining its origin from the ilium and obturator fascia. This is the obturator fascia covering obturator internus muscle. So this is iliococcygeus because it goes and inserts into the coccyx. And next moving on to this pubococcygeus muscle. Pubococcygeus is further divided into the muscle where around which organ it is, around which part it is present. So here we can see a muscle around the rectum. This is the rectum. It is forming a sling around the rectum. So it is gaining its origin from the pubis and forming a sling around the rectum. So it is called as pubococcygeus muscle. And similarly the muscle around the urethra is pubourethralis, and around the vagina is pubovaginalis muscle. So this is about the parts of pubococcygeus. So pubococcygeus is further divided into puborectalis, which is a major component, then pubourethralis and pubovaginalis. So all these things we can see they get origin from the body of the pubis, tendinous arch of obturator internus, obturator fascia, which is covering the obturator internus. Then ischial spine, here is the ischial spine, and inferior end of the sacrum, we can see the lower part of the sacrum also provides attachment and inserts into the coccyx and perineal body, and also the part of the muscle fibers attached to the anococcygeal raphe or anococcygeal ligament, which is below the coccyx and the anal canal. So it is called anococcygeal raphe. And in males along the walls of the prostate, or in females along the walls of vagina. In males it is called prostate muscle, and whereas in females it is called pubovaginalis, and around the rectum puborectalis. So that is about the parts of pubococcygeus, which is a part of levator ani. And next, nerve supply of these muscles, pelvic floor muscles, they are supplied by the branches from S4 to NIS5 spinal nerves. So S4 to S5, to levator ani, especially we say nerve to levator ani, having the root value of S4. And inferior pelvis, this part, this forms the inferior pelvis. So mainly from S4, S5, that's how you can remember, and levator ani especially by S4. So that is about the coccygeus and levator ani muscle, which forms the pelvic floor. And these two muscles which forms the pelvic floor or pelvic diaphragm, this mainly supports the pelvic viscera. We can see it is surrounding the rectum, vagina and urethra. So it supports the rectum and the uterus and urinary bladder, pelvic viscera, and also helps in the flexion of coccyx. The coccygeus muscle helps in the flexion of coccyx, and most of the pelvic diaphragm that supports the pelvic viscera and resists the intra-abdominal pressure. So that is the main action of pelvic diaphragm. So pelvic diaphragm, we can see here this red color. This is the lateral view for us to understand the relationship of pelvic diaphragm with pelvic viscera. So posteriorly here is the sacrum. We can see coccyx at the end of the sacrum, and anteriorly pubis is present, and here is the urinary bladder. This is the uterus continuing as cervix and vagina, and rectum below as the anal canal. So this pelvic diaphragm, we can see this red one, it mainly separates the pelvic cavity from perineal region. So above to which is the pelvic cavity, and below to the pelvic diaphragm is the perineal region including perineum. So perineum is part of pelvic outlet located inferior to the pelvic diaphragm. So pelvic cavity or the true pelvis has the pelvic floor as its inferior border, and pelvic brim as the superior border. So here we can see the superior border is the pelvic inlet, pelvic brim, that is the superior border, and inferior border is the pelvic outlet. So this is the pelvic diaphragm. So lesser pelvis or true pelvis is between the pelvic inlet and pelvic diaphragm muscle. And below the pelvic diaphragm, this part is the perineum. So some sources do not consider pelvic floor and pelvic diaphragm as synonymous terms. They consider pelvic diaphragm means only levator and coccygeus are the two muscles forming pelvic diaphragm, while the pelvic floor should also include like perineal membrane and deep perineal pouch. Deep perineal pouch contains urogenital diaphragm, which I am going to discuss in later sessions. So deep perineal pouch, including urogenital diaphragm and perineal membrane, and along with the levator ani and pubococcygeus, all together it is considered as pelvic floor. Pelvic diaphragm means only two muscles, levator ani, coccygeus together forms pelvic diaphragm. So pelvic floor, that is, we can see here several overlapping sheets of muscles and connective tissue forms the pelvic floor, and it closes the pelvic and the abdominal cavities and bear the load of the visceral organs. That is the main function. It controls the opening of gastrointestinal and urogenital tubes that pierce through it, and it has majorly two openings. One is for the gastrointestinal tract and urogenital tubes which pierce through it and make these two hiatuses. So the two hiatuses are anteriorly urogenital hiatus, which through which the urethra and vagina will pass through in females, and in males only urethra will pass through. And posteriorly the anal hiatus, we can see this is the posterior side anal hiatus through which the anal canal passes through. So here we can see this is the levator ani muscle and this is the coccygeus muscle, and this is obturator internus. This is coccygeus, this is obturator internus, this is parts of levator ani, this is puborectalis, this is iliococcygeus, and we can see the piriformis as well. So we know now the pelvic diaphragm separates the pelvic cavity above from the perineal region, and it lies posterior and deep to the urogenital diaphragm and medial and deep to the ischiorectal fossa. So this one is this gap in the perineum is the ischiorectal fossa, and above to the ischiorectal fossa is the true pelvis or lesser pelvis. So this pelvic diaphragm separates the ischiorectal fossa from the true pelvis on the posterior side of the perineum, where we can see ischiorectal fossa or ischioanal fossa present on each side of the anal canal. So these muscles forms the pelvic floor, and it supports mainly the pelvic viscera, which I said already. And on contraction of these muscles, it raises the pelvic floor up, and it flexes the anorectal canal during defecation and helps the voluntary control of micturition. So it helps in direct the fetal head towards the birth canal at parturition. So during parturition also pelvic diaphragm helps in direction of fetal head, fixes the fetal head properly into the birth canal during delivery or parturition. So that these are the main components and important functions. So let's see the parts again. It is mainly composed of levator ani and coccygeus muscle. So this is the posterior side of the pelvis from above. This is the anterior side, and we can see inner aspect or the pelvic surface of the sacrum. So posterior most muscle is the coccygeus muscle here, and in front of the coccygeus we can see different colors. All these are the parts of levator ani muscle. So levator ani and coccygeus covered by parietal pelvic fascia and associated with connective tissue which span underneath the pelvis. So these muscles arise between the pubic symphysis and ischial spine. So from the pubic symphysis laterally ischial spine and converge on the coccyx. Posteriorly they all, you can see they are all converging towards posteriorly. Coccyx, anococcygeal raphe, and which spans between the tip of the coccyx and the anal hiatus. This is the anal hiatus. So the right and left levator ani are almost horizontal in the floor of the pelvis, separated by a narrow gap from which it transmits the vagina and urethra. So you can see vaginal opening and urethral opening, and in males only urethral opening will be present. And we can see the anal canal, anal opening passing through this. And levator ani is mainly consists of two parts. One is pubococcygeus muscle, which is the anterior part, and iliococcygeus muscle, which is the posterior part of levator ani muscle. Pubococcygeus runs backwards, we can see runs backwards from the body of the pubis. That is the reason it started with pubo name, pubococcygeus, and their fibers are towards the coccyx. And some fibers are inserted into the prostate, urethra, vagina and anorectal junction, and they are named accordingly. Like puboprostaticus is the muscle which surrounds the prostate gland, and pubourethralis which surrounds the urethra. Prostate is, this is a female pelvis, so we are seeing the vaginal opening. But if it is a male pelvis, we know that about urethra, the prostatic part of the urethra, the muscle inserts around the prostatic part, so it is called puboprostaticus. And pubourethralis muscle here, and pubovaginalis we can see here around the vagina, which is called pubovaginalis, and pubourethralis is around the urethra again. Then puborectalis, which is the major component here around the rectum. This is makes a sling. And iliococcygeus here, which is like a almost separate muscle part of levator ani, attaches from the ilium, iliococcygeus, from the pelvic surface of the ilium and also from the part of the hip bone, and inserts into the coccyx bone, and which is present on the posterior aspect. And as it is not well developed, ischio-coccygeus, or simply called as coccygeus muscle, is situated behind the levator ani, and frequently the tendinous arch as much as the muscular and extends from the ischial spine. So this one coccygeus muscle extends from the ischial spine to the lateral margin of the sacrum and coccyx. So that is about the coccygeus. So now we know levator ani has got pubococcygeus and iliococcygeus. Pubococcygeus is further divided into pubourethralis, puboprostaticus, then pubovaginalis and puborectalis. I hope you understood this. And iliococcygeus from ilium to the coccyx, and also the inner surface of sacrum. Then coccygeus from the ischial spine, it is called ischio-coccygeus, from the ischial spine, and inserts into the sacrum and coccyx. So let's see the functions. The functions of the pelvic diaphragm, we can see here anteriorly this is the pubis, and here is the sacral vertebra, sacrum, and we can see the rectum, and here is the urinary bladder, and this is the male pelvis, so you are seeing the prostate gland, and this red one is the pelvic diaphragm. You can see this red one, which is the pelvic floor muscles or pelvic diaphragm. So this pelvic diaphragm, it is like an excellent support of pelvic viscera like urinary bladder and rectum, and in females it also supports the uterus and helps in the maintenance of continence, means control, as a part of urinary and vaginal and anal sphincters. That external sphincters of urethra and anal canal, they are all controlled because of its support. So it is under the continence is maintained by these pelvic floor muscles, and also it helps in facilitates birth, helps in fixing of head, and resisting the descent of presenting part, and causing the fetus to rotate forwards to navigate through the pelvic girdle. So that's how it helps in parturition also, and helps in the maintenance of optimal intra-abdominal pressure, And suppose if this pelvic diaphragm is damaged, especially women who had given normal birth through the vagina, there may be a chance of tear of this pelvic diaphragm. So in that case, what happens if there is a damage to the pelvic diaphragm? It leads to prolapse of pelvic viscera and incontinence. So prolapse of vaginal prolapse and uterine prolapse may be there, and rectal prolapse would be there in those women who had weaker pelvic floor muscles. So pelvic floor muscles can be strengthened with Kegel's exercise. So this Kegel's exercise will strengthen the pelvic floor muscles. So next we shall talk about the perineal body also, which is an important support present in the perineum. It is called perineal tendon, and because it is very important in women supporting the uterus, it is also called as gynecological perineum. It is the central perineal tendon, which is a fibromuscular tissue located in the midline at the junction between the anal triangle and urogenital triangle. So we can see here, this is the pelvic outlet. What you are seeing from outside of the pelvis, pelvic outside, we can see the acetabulum where it articulates with the head of the femur to form hip joint. We can see the ischial tuberosity, and these ligaments what you are seeing, these are ischiotuberous ligaments. From ischium to the tuberosity it goes, so it is called as ischiotuberous ligaments. And we can see this is a male pelvis and here is the female pelvis. So in female pelvis we can see the opening of urethra, vagina and the anal canal, and the whole perineum can be divided into two triangles by an imaginary line here, and where we can see anterior triangle is the urogenital triangle and posterior triangle where the anal canal is traversing the posterior part of the perineum is the anal triangle, and we can see anococcygeal raphe here. This is the anococcygeal raphe. So this is the anal triangle. So where is our perineal body? The perineal body is here. So it is it is at the junction between the anal triangle and urogenital triangle. So it is just anterior to the sphincter, and in males it is found between the bulb of penis. This is the bulb of penis and the anus. So it is between the penis and the anus, the bulb of penis and anus. We can see the perineal body in males, and females it presents between the vagina and the anal canal. This is the vagina and the anal canal, in between this is the perineal body. So it is we say it is approximately around 1.25 centimeters in front of the anus in females, in males as well. And structures attached to the perineal body, this is quite important. Perineal body is a fibromuscular structure, I already said. So several perineal muscles, they intersect with each other at the site of perineal body, giving important strength. So it provides support to the pelvic viscera. So let's see what are the muscles intersecting. External anal sphincter. So here is the anal canal. This is the external anal sphincter, provides attachment to the perineal body as well. And we can see the bulbospongiosus muscle in male, and superficial and deep perineal muscles, transverse perineal muscles, superficial and deep on each side, they are present transversely. So superficial and deep transverse perineal muscles, anterior fibers of levator ani, that is pubococcygeus part of levator ani, and also the puborectalis part of including puborectalis and pubovaginalis, which are the parts of pubococcygeus, take part in the formation of perineal body, and fibers from the external urinary sphincter and conjoint longitudinal coat of rectum, and perineal body is like can see here. So all these muscles take part in the formation of perineal body. So external anal sphincter, bulbospongiosus, superficial and deep transverse perineal muscles, and anterior fibers of levator ani including puborectalis, pubovaginalis, and external urethral sphincter and conjoint longitudinal coat of rectum. So perineal body is an important support of pelvic viscera and it is essential for the integrity of pelvic floor muscles. So perineal body tear during vaginal delivery leads to widening of the gap between the anterior free borders of levator ani muscle of both the sides. So levator ani muscle of both the sides, the gap between them would increase if there is a tear of perineal body, and this becomes a predisposing factor in those women which leads to prolapse of pelvic viscera like urinary bladder, uterus and rectum would prolapse. So that is about the perineal body. So let's see some high yielding points. So we know now what is pelvic diaphragm. I hope I am clear with you all that pelvic diaphragm is what and pelvic floor is what. Actually many consider pelvic floor includes not only pelvic diaphragm, it also includes urogenital diaphragm including the deep perineal pouch and perineal membrane and connective tissue and fascia also covering them. All this is called pelvic floor. Pelvic diaphragm means only levator ani and coccygeus. Levator ani and coccygeus forms the pelvic diaphragm. I hope I am clear with this. And levator ani, these are the parts of levator ani. Coccygeus is otherwise called as ischio-coccygeus muscle. And pubococcygeus, which is a part of levator ani, has further divided into pubourethralis, puboprostaticus in males, pubovaginalis in females, and puborectalis. And right and left puborectalis, they unite behind the anal. You can see this is the anal canal. And right and left puborectalis, they unite behind the anal canal, forming a muscular sling around the anorectal junction, which forms the perineal flexure of rectum. So because of this muscular sling, what happens? The rectum will take a turn which is called as anorectal junction, and then it continues to form anal canal. So that is called perineal flexure of rectum. Next, about the sacrospinous ligaments may represent the degenerated part or aponeurosis of ischio-coccygeus. So ischio-coccygeus also actually morphologically forms a sacrospinous ligaments. Sacrospinous ligaments, they represent the degenerated part of ischio-coccygeus muscle. So these are the high yielding points.